The research on immunizations is always population-based. Therefore, it's impossible to draw firm conclusions. Now, I'm a little bit skeptical about the immunization industry. Here's the problem looking at the broad scope of immunizations. There are just too many of them. We want people to stay healthy. Okay, that's a good thing. But do the immunizations do that? And you have prostate cancer, and should you then get immunized? Stress can invite cancer to progress. Immunizations can either cause stress by virtue of the shot itself or potentially prevent it by virtue of avoiding an illness. But should you get an immunization if you're fighting prostate cancer? What effect will that have on the underlying malignancy? I'm going to break it down for you. We're going to go over the adult immunizations, at least those that are most commonly recommended, and I'll share with you my thoughts. It's a difficult topic to tackle. The research on immunizations is always population-based. Therefore, it's impossible to draw firm conclusions. Now, I'm a little bit skeptical about the immunization industry. Now, we got to separate that from individual choices. Here's the problem looking at the broad scope of immunizations. There are just too many of them. A good idea went haywire because pharmaceutical companies started to realize they're kind of running out of stuff to treat. They have antibiotics, which are great when you need them, but it's a limited treatment. A 7-day run of an antibiotic is not going to keep a company profitable. Then you have chronic diseases. I mean, how many new blood pressure drugs can they come up with? Cholesterol drugs. They're starting to scope around looking for profit opportunity. Now, if you take the entire population of healthy people and you decree that they need an immunization, holy cow, you have buckets of money to be made because you don't actually ever have to have an illness. You don't need to be sick at all for a company to then profit by making you fearful of an entity that may or may not happen and give you a treatment that doesn't actually need to work. I mean, how many of y'all had a COVID shot? How many of y'all got COVID afterward? Yeah, okay, me, I can raise my hand. I'm not dismissing the value of all immunizations, but we have to look at this with our skeptical view of big pharma, of our skeptical view of the collusion that often occurs between big medicine, big pharma, big government, and even when that sort of impetus has a noble underpinning. We want people to stay healthy. Okay, that's a good thing. But do the immunizations do that? And you have prostate cancer, and should you then get immunized? Couple of problems. One of them is we just don't know what an immunization will do to the underlying disease state itself. When you get immunized, almost to a shot, there can be an immediate short-term negative effect. It can be a fever, headache. In other words, we're inducing a transient inflammatory imposition on the body, which is not a good thing when you're trying to keep your immune system pristine. So there's that factor. That which causes stress to the body equates to a compromise of immune resilience that can enable the cancer at a cellular level to kind of start to creep forward a little bit. So I've seen this happen in clinical practice. Somebody's going along pretty well, they're in remission, and then they get nailed with another illness. They go on a cycle of prednisone, or they get a surgical intervention, and all of a sudden, the guard is down. So there's that factor. But on the other hand, you're also at risk. When you have cancer, if you have prostate cancer isolated within the gland, it is very unlikely that the cancer itself is compromising your immune system because now it's pretty isolated. Although it certainly can happen. Cancer, occult, undiagnosed cancer, weakens the immune system. In fact, one of the immunizations I'll be talking about is a Shingrix. That's the one for shingles. If you get shingles, it can be an early warning sign of a hidden cancer. So those of you that have had shingles, you owe it to yourselves to scrutinize, is there cancer underneath this? Typically that risk look back is about 6 to 12 months. So the immune system can be weakened by virtue of the malignancy, And if you're sick, if you have prostate cancer and you get pneumonia and you get hospitalized, what will that do to you? So we have to weigh these against the likelihood that you're going to get the disease in the first place. So leading my list of immunizations that I don't recommend is actually COVID. I just don't feel that this immunization has proven its merit. To me, an immunization works when you don't get the illness. By that measure, the COVID shot is a dramatic failure. I know the advocates will tell you, well, it would have been much worse if you didn't get the shot. Right? That's a little bit circular logic and self-feeding, and there's no way you could prove it. So I'm not an advocate of the COVID shot really for anybody. I had to get it. I'm a doctor. I was required to. I like my job, so in order to stay in practice, I had to get the COVID shot. Some of you out there that are in the working world, you're nurses, you're healthcare providers, sometimes we have to do things that are not necessarily in our best interest, at least we don't believe it to be, but it is in the interest of the population we serve. So bear that in mind as you're contemplating this. I don't think it's worth sacrificing your career to avoid a COVID shot. If you're in the healthcare field, we have to just accept more risk by the nature of our calling, right? How about the tetanus shot? Tetanus shot, I don't know if there's ever been a case of tetanus in any adult who's been primarily immunized as a child. The idea that we have to have it every 10 years, speculation at best. The amount of tetanus that occurs is minuscule. It is hard to even decipher it as an illness. On the other hand, it's fatal if it happens. So as a routine, I don't recommend it. As a prophylaxis when you're exposed at a high risk, yes, because there's no other cure and you will die from tetanus if you catch it. That's called the Tdap, tetanus, diphtheria, and acellular pertussis shot. There's a capital T with a lowercase d. That refers to the diphtheria for adults, which is a little bit weaker than that for children because you've already been primarily immunized. Well, what about diphtheria? Nobody gets it. I mean, practically nobody gets it. From 1996 until 2018, 14 reported cases in adults, 14 by the research I could acquire. Are you really going to get immunized when the disease you're immunizing against doesn't really happen? So a tetanus booster, a Tdap, I think is one that I would not support getting for my patients. Anytime you get these shots, right, you can have a fever, headache. It can make you feel bad. For what gain? And pertussis, that's equally rare from 2,000 and 2 out of 200 out of 100,000. So pertussis in adults, 2 cases out of 100,000 people, it's pretty rare. And the notion of it causing death, unless you're really, really weak and feeble to begin with, if you do happen to catch it, you're more likely to survive it. So it's hard to get excited about an immunization that doesn't have a huge upside benefit. How about hepatitis B? Hepatitis B can protect against liver cancer. The virus can contribute to the formation of liver cancer. Those of us in healthcare, we're required to get it. Nowadays, they give it to children in a nursery, so you may not need this at all, but in the absence of risk, I don't recommend it as a routine. Hepatitis B for adults, it's a sexually transmitted disease, or it's transmitted through blood exposure. So if you are a low-risk individual with regard to your sexual activity and with regard to blood exposure, there's not a ton of value here getting the Hep B shot for you. Hepatitis A is the one that is foodborne, that gives you diarrhea. Not really a fatal illness. It's annoying. I'd rather not get it, but it's not high on my list. Maybe if you're on that safari to Africa, right? Immunizations are different if you're traveling to third world. So far we've got the Tdap, not really endorsing it. COVID, don't see a big upside. If you catch COVID while you have prostate cancer, will it expose you to this risk escalation? It may. The best advice is to keep your immune system as strong as you can through your healthy lifestyle, good sleep quality, modest exercise. High intensity exercise will weaken your immune system. You go out and do a 10K or you do a marathon, you're going to feel bad because your immune system is going to take a dip. So if you like vigorous exercise, it's your prerogative. But don't do it if you think it's good for your health. It is weakening to the immune system. High intensity. Activity, good. Ninja workout, killing it in the gym, washboard abs, crazy work. No, just no. If you like it, I'm okay with that, right? But as a health enhancer, not so much. How about the flu shot? A disappointment, isn't it? They come out with this every year, and every year they're kind of guessing. Here's what I like about the flu shot. At least it's old. At least the technology's been around a long time. And if you catch the flu, you'll wish you had the shot. It's a miserable week. And if you catch the flu, is that going to put you at risk for cancer acceleration? This is a tough one, folks. I'll leave it to your discretion. If you perceive yourself at higher risk, you have lung disease, you're immunologically weakened, you're past the age of 65, the immune system starts to drop, I don't object to a flu shot. I think it has a rational place for those of you that are philosophically inclined. Some of you will say, yeah, I'm not going to get that flu shot because it gives me the flu. It can make you sick a little bit, right? It can make you feel bad. So you really got to contemplate if you want to expose yourself, and if so, what's the gain? It's an interesting side note, but years ago, before the era of antibiotic, there was a doctor who was treating advanced stage cancer by giving people sepsis, injecting them with bacteria to create high fever, like took 103, 104 really sick people. Now, some people died. Well, these were folks that were terminal to begin with. Not that that's to disregard their quality of life or the value of their life, but the risk benefit the doc felt was worth it. This is back in the 1800s, I think. Some of the people, however, had a striking remission, implying that the immune system, when superactivated through a febrile illness, may actually have anti-cancer properties. It's a fascinating theory. We're seeing it played out in oncological treatment now, as some of the newer treatments are targeting not necessarily killing cancer cells, but helping to support immune function. That is interesting to me because I'm going to flip it around. Maybe I'm not saying to go out and catch the flu, guys, but maybe catching the flu and having a high fever isn't the worst thing. Maybe it would amplify immune function in a way that would have an anti-cancer attribute. This is pure theory, guys, so do not run out and say, Dr. Petteruti says I should catch the flu so it fights cancer, right? No, it's not what I'm saying. I'm thinking with you, intellectual medicine, right? Should I get the flu shot or not? Maybe I'll take my chances, and if I catch the flu, I'll just nurse myself through it. By the way, while I'm on the topic of fever and flu, do not treat a fever. The fever is your friend. It helps your immune system work better. It helps the white blood cells work better. It helps beat the infection. Do not treat a fever unless you just feel so god-awful. You're so symptomatically miserable that you want to lower the temperature. A high temperature from an infection will not damage your brain, does not cause bodily harm. It is controlled, it's thermoregulated by your body. The only time a high temperature can damage you is when it's pathologically induced. Something's wrong with you medically that you can't control that temperature properly. When I was a little kid, my mom feared fever so much. When we got a high fever, she'd give us a cold water enema. She said, bring that fever down like crazy. The number looked good, but it was likely harming our recovery because that fever is your friend. Another great example of our impulse to treat a number rather than focus on the outcome. So here, we're keeping score. The flu shot is a maybe. Tdap is a no-go. Hep B, generally a no-go unless you're at risk. Hep A, if you're going to Africa, yep. How about varicella? How about a chickenpox immunization? Look, when I grew up And so, I'm 60 something, 66, I'll let it out. When I grew up, we all got chicken pox. When one kid got it, my mom would put all the other kids in the room so to knock it out of the house in one sweep. If you've had chicken pox, you've got lifetime immunity. If you're one of those rare human beings who somehow made it to adulthood without actually ever getting chicken pox and you're at risk for it, you want to get immunized because primary chicken pox as an adult is a horrible hospital level disease, but it's pretty rare not to have been exposed as a child. So COVID, a no-go. Let's move on to the pneumococcal immunization. This is most fascinating because it actually has some protective value, and it's one that you need to consider. The pneumococcal pneumonia has a significant hospitalization rate and death rate. This is a far cry from the other one, respiratory syncytial virus, the RSV. RSV, when I was a kid, when I was younger in my profession, we called that a cold. Now, they're having you fearful of it. The triple-demic, it's COVID, it's RSV. Take a deep breath. RSV's been around since like the Stone Age, and it gives you a cold. Do some people die from it? Yes. Are those people otherwise intact and immunologically healthy? No. Do those people likely have a mortal event in the near future? Probably. I'm not saying that wishing death upon anybody, but we have to put the disease risk in its perspective. If you're strong, vital, healthy, you're not going to die from RSV. You're not going to die from COVID. You don't need the immunization. The immunization is a profit engine for the company making it. And the only way they can make money on it is if they convince the population that this disease is a dread scourge needing to be obliterated with a shot. I don't buy it. Now, pneumococcal, that's a little different. Stats on that. 400,000 hospitalizations, of which 20,000 will die. The pneumococcal pneumonia is a potentially fatal disease. This is not your head cold. It's not COVID. It's not respiratory syncytial virus. It's in the lung, I can't breathe. Who should get it? If you're over 65, you give it some thought. At about the late 50s, early 60s, probably around 62, 63, something happens to the human body in the arc of aging. It's called somatopause. And it's when the pituitary gland is not pumping out growth hormone at its historical levels. When that occurs, the thymus gland, that's the one underneath the breastbone, withers. It turns into a glob of impotent fat. Something I want to make sure never happens to you, men. Impotent fat. You never want to be that. You never want to be a worn-out thymus gland. Anyhow, when it happens to the thymus, the body has trouble making T cells, making immunoglobulins, and the immune system drops. So past 65, reasonable to consider. If you have a history of asthma, chronic lung disease, I recommend this immunization. The risk-benefit favors it. How about if you're otherwise strapping, healthy, feeling great? I'm going to fight pneumococcal with my own immune system. That's cool, and I don't discourage it. And I don't feel the immunization is compulsory, but it has advantages, and it's worth considering. Now on to Shingrix, the dreaded shingles. So earlier, when they had the old Zostavax, it was called, it was a weakened live virus. It was not terribly effective. It's no longer on the market because Shingrix has displaced it. I kind of like this one, guys. The Shingrix has a greater than 90% efficacy. That means upwards of 95% success rate in you never getting shingles. And the duration, 7+ years and counting. As we watch this immunization over the years, its merit continues to be reinforced. Another thing I like about this, study done recently, correlated people getting the Shingrix with a lower incidence of acquiring dementia, Alzheimer's disease. Now this makes some biological sense because the virus that causes shingles, the varicella, lives in the nerve. And the study was not corporate sponsored. In fact, Glaxo, the company that makes the Shingrix, they didn't even know the study was being done. They didn't know about it until it got published, until it was completed. I love that they did that because I am skeptical when I see a drug company involved in a study in an intimate way. They had nothing to do with this one. It came out of national funding. So is it worth getting? I'm starting to lean towards it. The old thinking, my old thinking on this was shingles doesn't kill people. There is a treatment for it. There's an antiviral that you can use that helps mitigate the symptom and goes away on its own. So those are all reasons to not get the immunization. The other reason that I haven't gotten it up until now is because I wanted shingles as my early warning system of possible cancer or immunological weakness. If you catch shingles, something's wrong. Not catch shingles if you develop it, right? Remember, shingles is a reactivation of the chickenpox virus you had as a kid that got buried in the nerve and lay dormant. This notion of viral dormancy is compelling. In fact, it informs us about cancer dormancy. It informs us about the capacity for virions, and I maintain cancer cells, to be in a dormant state for decades, maybe throughout life. And the only time they peek their head above the horizon is when the immune system takes a hit. So keeping the immune system strong, yes. Avoiding Shingrix so that you can catch shingles as an early warning system, I don't think that is as relevant with this new immunization. Highly effective, long duration of benefit, and oh, by the way, a reduction potentially in Alzheimer's. Starting to lean toward advocating it. Let's go back to your prostate cancer. If you catch shingles and your immune system is being drained fighting the shingles, that's probably not a good thing. It's like fighting a two-front war. So kind of looking back at this, you have to make your own decisions, men. You're walking on the frontier with an unknown outcome, no matter what path you choose. But you can tilt things based on specific information. COVID, I don't like. Respiratory syncytial virus, I don't like. I'm skeptical about the rush for new immunizations to protect us from the various diseases that are out there. There are too many of them to chase, but it's a bounty of profit for the companies. The pneumococcal immunization, shared with you my thoughts, has some logic behind getting it for many of you, although I respect those who choose not to. A tetanus booster, not needed. The flu shot, ambivalent. COVID shot, just don't like it. I don't like it. The idea of getting an annual COVID shot, we just don't know what we're doing. We just don't know what comes next, what happens. This is rushed science at the best. I think we should put the COVID shot, for those of you who choose to get it, as an ongoing research project. The Shingrix, we spoke about that. So keep your immune system strong. That's universal. Whatever you decide to do, should you get a shot, immunization, or not? Do I do a flu shot or not? Keeping the immune system robust, that's at the base. So we'll be continuing to talk about that, making sure your vitamin C is up to date, having lots of it in you. Your vitamin D level should be above 50. Your percent body fat, keep it in check. Modest alcohol use. Take good care of your body, and your immune system will follow. Well, gang, that's all for now. Thanks for sharing time with me. I'll see you next time.